Assalamu alaikum. This is me, dietitian Mahnoor, and today I'm gonna talk about therapeutic cardiac diet. We're gonna go through some slides. First of all, we're gonna talk about objectives. Explain the connection between diet and cardiovascular disease. Define heart healthy diet and identify the goals of heart healthy diet and keys to the cardiac nutrition therapy. Define dash diet and dash diet recommendations, and also we're gonna see the sample for 1 day menu. The connection between diet and cardiovascular disease. Diet directly affects the development of atherosclerosis, the underlying cause for cardiovascular disease. Diet also affects the blood cholesterol levels, body weight, blood pressure, and blood glucose levels. What is heart healthy diet? A heart healthy diet is high in omega-3 fats found in fish, especially salmon, high in fiber, high in fruits, and in green, red, and orange vegetables, low in saturated fats and trans fats, low in sodium, low in sugar, low in cholesterol, low in alcohol or alcohol free, calorie balance to support a healthy weight. The goal of heart healthy diet are to eat foods that help obtain or maintain the healthy levels of cholesterol and fatty molecules called lipids. You can achieve this by reducing overall cholesterol levels and low density lipoproteins, which are harmful to the heart. Increasing high density lipoproteins, which are beneficial for the heart, reducing other harmful lipids, fatty molecules such as triglycerides and lipoproteins. Any diet should also help keep blood pressure and weight under control. Keys to cardiac nutrition therapy. Fats and oils. Limit saturated fats and trans fats. Food high in saturated fats include fatty meat, poultry skin, bacon, sausages, whole milk, cream, and butter. Trans fats are found in some fried foods and baked foods made with hydrogenated oils. Limit amount of cholesterol that you eat, less than 200 mg per day. Food high in cholesterol includes egg yolk, fatty meat, whole milk, cheese, shrimp, lobster, and crabs. Eat more omega-3 fats. Good choice include salmon, tuna, mackerel, and sardines. Other foods with omega-3 fats include walnut and canola and soya bean oil. Limit that total amount of fat that you eat, including the heart healthy fats, to 25% to 35% of the calories that you eat. Diet can influence the LDL cholesterol level. A typical American diet contains about 40% of its total energy content as fat. Half this energy is in the form of saturated fatty acid, one-fourth as monounsaturated fatty acid, and one-fourth as polyunsaturated fatty acids. The quantity and nature of dietary fats can influence the level of the plasma cholesterol. High level of saturated fats in the diet results in the increase in plasma LDL cholesterol. Carbohydrates, fiber, and sugar. Carbohydrates are either complex as in starches or simple as in sugars. Many studies report that people can protect their heart and circulation by eating plenty of fruits and vegetables. Complex carbohydrates, fiber found in the whole grains and vegetables are preferred over those found in starch-heavy foods such as pastas, white flour products, and white potatoes. Most complex carbohydrates are high in fiber, which is important for health. Whole grains are extremely important for people with diabetes or those at the risk for it. The recommended daily intake of dietary fiber for heart protection: at least 25 grams for women and 38 grams for men. Old women and men, at least 21 and 30 grams of fiber. Different fiber types may have specific benefits. Insoluble fiber and soluble fiber. Insoluble fiber found in wheat bran, whole grain seeds, nuts, legumes, and fruits and vegetables may help achieve weight loss. Consuming whole grains on a regular basis may lower the risk for the heart disease and heart failure. Soluble fiber found in dried beans, oat bran, barley, apples, and citrus fruits may help achieve healthy cholesterol levels and possibly reduce the blood pressure. Sugar. Doctor recommends that no more than 10% of daily calories should come from sugar. Sugar are usually one of two types. Naturally occurring sugars are found naturally in foods such as fructose in fruits and milk, lactose. Added sugar include any sugar or caloric sweeteners that are added to food or beverages during processing or preparation. Added sugars can include natural sugars such as white sugar, brown sugar, and honey, as well as other caloric sweeteners that are chemically manufactured, such as high fructose corn syrup. Proteins. Proteins Protein is found in animal-based products, meat, fish, and dairy, as well as vegetable sources such as beans, soy, nuts, and whole grains. In general, doctor recommends that protein should provide 12 to 20% of daily calories. Fish is probably the best source of protein. Evidence suggests that eating moderate amount of fish twice a week may improve triglyceride, HDL level, help lower the risk for the death from heart disease, dangerous heart rhythm, blood pressure, a tendency for blood clots, the risk for stroke. Finding balance, choosing the right kind and amount of proteins. When choosing proteins, optimize for the low-fat options such as a lean meat, skim milk, or other foods with high level of protein. Choose main dishes that combine meat and vegetables together, such as low-fat soups or stir-fry that emphasizes veggies. Watch portion size. Aim for 2 to 3 ounce serving. If you are having an appetizer, try a plate of raw vegetables instead of a cheese plate. Cheese adds proteins but also fats. Vitamins. Antioxidant vitamins are a group of compounds that help to produce the body from the formation and elimination of free radicals. Free radicals are formed from exposure to the sunlight and pollution, and also as a byproduct of the cell metabolism. Alcohol, cigarette smoke, stress, and even diet also affect the level of free radical development in the body. Vitamin E. Vitamin E, a fat-soluble vitamin present in nuts, seeds, vegetable and fish oils, whole grains, fortified cereals, and apricots. Vitamin C, a water-soluble vitamin present in citrus fruits and juices, green peppers, cabbage, spinach, broccoli, kale, cantaloupe, kiwi, and strawberries. Vitamin K. Vitamin K stops the vascular calcification. Vitamin K stops the vascular calcification. It appears to active a protein in artery walls that keep the calcified, hardened section of blood vessels from expanding and causing more damage. Beta carotene. Beta carotene is present in liver, egg yolk, milk, butter, spinach, carrot, squash, broccoli, yams, tomato, cantaloupe, peaches, and greens. Vitamin A has no antioxidant properties and can be quite toxic when taken in excess. Minerals. Potassium rich diet can provide a small reduction in blood pressure. Potassium rich foods includes bananas, oranges, pear, prunes, cantaloupe, tomatoes, rice, peas and beans, nuts, potatoes and avocados. Potassium supplements should not be taken by patient without checking with your doctor first. For those using potassium sparing diuretics such as spironolactone or having the chronic kidney problems, potassium supplements may be very dangerous. Magnesium. Some studies suggest that the magnesium supplements may cause small but significant reduction in blood pressure. The recommended daily allowance of magnesium is 320 mg. Calcium regulates the tone of the smooth muscles lining blood vessels. Studies have found that the people who consume enough dietary calcium on a daily basis have lower blood pressure than those who do not. Studies have indicated that calcium supplements do not prevent heart disease, and some controversial reports suggest that they might even increase risk. Sodium. Sodium increases blood pressure because it holds excess fluid in the body, creating an added burden to your heart. Blood pressure rises with age, and eating less sodium now will help curb that rise and reduce your risk of developing other conditions associated with too much sodium, such as stroke, heart failure, osteoporosis, stomach cancer, and kidney disease. Some tips to lower your sodium intake. Look for food that are labeled low sodium, sodium free, no salt added, or unsalted. Check the total sodium content on food labels. Don't cook with salt or add salt to your food. Try pepper, garlic, lemon, or other spices for flavor instead. Avoid processed meat. Processed meat have been associated with the increased risk for the heart disease. Avoid food that are naturally high in sodium like nuts, olives, pickles, soy, tomato, and other vegetable juices and cheese. Take care when eating out. Stick to steamed, grilled, baked, boiled, and broiled foods with no added salt, sausages, or cheese. Use oil and vinegar rather than bottled dressing on salads. Eat fresh fruits or sorbet when having dessert. Sample. Now we're gonna discuss about our sample menu. Okay. Meal breakfast, half cup apple juice, 3-4 cup oatmeal with 1 small banana and 1 cup skim milk, 1 cup brewed coffee. Lunch, turkey and cheese sandwich, 2 sliced whole wheat bread, 1 ounce low fat Swiss cheese, mustard, 1 medium sliced tomato, shredded lettuce, 1 cup skim milk. Evening meal, 3 ounces broiled fish, 1 cup brown rice with 1 teaspoon soft margarine, 1 medium stalk broccoli and 1 medium carrot. Toast salad with mixed green tomatoes, chickpeas and olives and vinegar dressing. 1 cup of tea, half cup of non-fat frozen yogurt with fruit. Snack, 1 ounce trail mixed meat with nuts, seeds, raisins and other dried fruits, 1 cup blueberries and 1 cup skim milk. Now we're gonna discuss about the DASH diet. What is DASH diet? DASH diet stands for Dietary Approaches to Stop Hypertension. It is proven to help lower blood pressure and may have additional benefits for preventing the heart disease, stroke, and heart failure. This diet is rich in important nutrients and fiber. It also provides more potassium, calcium, and magnesium, but less sodium. As you know, that amount is written in front of your screen. You can read it. Okay. The next is the DASH diet recommendations. I'm gonna just end this topic now. Limit sodium intake to no more than 2300 mg a day. Reduce saturated fats to no more than 6% of daily calories and total fats to 27% of daily calories. When choosing fats, select mono unsaturated fatty oils such as olives, canola oils. Choose whole grains over the white flour or pasta products. Okay, this was all that we have discussed about the therapeutic cardiac diet. I hope so that you liked my video. Thank you very much.